As you probably know, this is actually quite a rare event in a Masters Games situation. We're aware that there were no previous deaths in Melbourne or Edmonton. As you know, heart disease is the number one killer in our environment, though at this stage we're presuming that was the cause. We had the minimum medical requirements in place, and as you know, our planning has been for 4 years, and in conjunction with the New South Wales Ambulance Service and Health, and also with the International Canoe Federation. We had safety officers and we had first aid presence on the water, including an aquatic rescue management boats with medical personnel on board who responded quite rapidly. We're confident that our emergency situations we put in place worked well today. Unfortunately, the result was not as we would have wished, and we're obviously very saddened by this event. I've been involved in Commonwealth Games and Olympic Games with elite level athletes, and I would suggest to you that the planning is very similar. We do have that in mind, but having said that, competition by Masters is generally very safe. As previous experience has borne out, they prepare for it, they work well for it, they declare to us that their health status is fit for them to compete. So my knowledge of preparation for both elite level sporting competitions of a large nature. The difference here is that we have 28,000 competitors. It's more a numbers game. They're required to declare to us that they're fit to compete at the time of their registration into the Games. They're given information, health information to help them determine whether that's the case. We provide first aid facilities at all venues. The competition cannot start without first aid facilities being there. So if one of our first aiders or one of our medical personnel is late for competition, held up in traffic or whatever, they wait till they arrive. We have, depending on the venue, we have varying degrees of response according to the numbers and the type of activities that's going to be performed.